My name's Summer May Finlay. I'm a Yorta Yorta woman, a PhD candidate, and this is my PhD blog. So I realised that I'm 12 months in and I still haven't told you what the hell my PhD is about. So here we go. I'm going to try and summarise it for you in a couple of minutes. I'm looking at a set of national key performance indicators which have actually been established to measure the Closing the Gap policy. Now, the formal agreement for the Closing the Gap policy is called the National Indigenous Reform Agreement, and that's actually the agreement that the Coalition of Australian Governments have come together and made. And the NKPIs, National Key Performance Indicators, sit under there to measure that agreement. So this actually was something that the Aboriginal community controlled sector actually identified as something they wanted to understand. They wanted to know what the impact of these NKPIs had on ACCHOs, which is the Aboriginal community controlled health organisations. So there's a couple of things that I wanted to do. There's 3 phases to my project, and within the first phase is actually looking at the documents relating to KPIs internationally and seeing what the effectiveness of KPIs are for measuring health outcomes and improving quality of care, because they're the 2 specific KPIs that are actually underneath the NIRA and the NKPIs. So the other thing that I'm going to do is actually look at the documents which report on the KPIs and see how they're being used and how they're being reported against. And that's both to kind of give us a bit of a context around the KPIs, their effectiveness generally, and also the way they're being used currently. The next thing I'm doing is actually going into phase 2 and in using phase 1 results to actually inform phase 2. Phase 2 has a number of different components underneath it. I'm doing case studies with ACCHOs, 4. I'm going to put out an expression of interest and see who wants to be engaged. And we want to get a bit of a spread across the country and also different science services and different services that are using the KPIs differently at either a local level or not at all. And then what I want to do is look at taking those results and formulating a survey for all ACCHOs to see how all ACCHOs are actually feeling about the KPIs. So both the survey and the case studies are going to look at the perceptions of effectiveness, the way that people think it's changed service delivery, whether or not there are barriers to implementing and reporting against the KPIs, or whether or not there's actually enablers. So we can get a really good understanding of what's happening. Now, we're also going to try and get a bit of an understanding of how they were developed and the perceptions of the public health medical officers around the barriers and enablers. So I'm going to do a focus group with the public health medical officers. They're from all around the country. Some sit within Aboriginal peak bodies, some sit with services directly. And this will give a really good understanding of what's happening across the country as well. And I think it's really important also to understand the perspective of policymakers too. So I'd really like to get interviews with people who are engaged in the technical reference group who actually created the NKPIs, but also people working in public service around what they think the barriers and enablers are and whether or not they think that, these are actually useful. And look, the whole idea is to come out with a set of recommendations for going forward with the KPIs. I'm hoping that we can have a tool which will be used for advocacy, and I think that this might actually have broader implications, not just for the NKPIs, but for other KPIs, because it is really important that we actually do measure what we're doing and evaluate what we're doing, but we also need to be mindful of whether or not they're effective, and if they are, under what circumstances, but also what the impacts of actually implementing them are and what services or supports we need for services to actually implement and report against them appropriately. So I think that ultimately I've got a really large task ahead of me. I've got a lot of people I need to speak to and I've got a lot of work to do, but I'm really, really hoping that we can have some sort of tangible outcome which the ACCHO sector can use to advocate. And I also hope that it would be useful for policymakers to actually understand when creating things like KPIs about what's effective, but also what is actually going to be something that is practical to implement within a health service. So that's my summary of my next 2 years of my life in 4.5 minutes. So thanks very much for listening, and hopefully I'm still looking as smiley as this next time you see me.